Hello, everyone, and welcome to Heads Up, the weekly podcast and webcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, chronic daily migraine survivor, and founder of the Facebook group Migraine Nation. I am here today with Dr. Vincent Martin, MD. Dr. Martin is the director of the Headache and Facial Pain Center at the University of Cincinnati, and he is also the president of the National Headache Foundation. Hi, Dr. Martin. How are you today?
Good, I'm doing great.
Thanks for being with us. So today we have a very interesting topic. I know we have lots of people out there who have had to stop using a particular medication that was probably very effective for their migraine, but the side effects were too much for them. And there's also a lot of people out there who experience that often. There's many medicines that likely the side effects are just too much for them. So we are going to talk about how to approach someone's care when they are experiencing side effects with lots of medicines. And Dr. Martin has a lot to say about this. So we're going to delve into this topic, and I think it's going to be very useful to all of us. So Dr. Martin, in your clinical practice, do you see this happen a lot? Do you see a lot of patients that experience side effects often?
Well, first of all, I think migraine patients overall tend to be more sensitive to side effects than other patients with other medical disorders. This is one of the most common questions that comes up is patients are concerned about what side effects they're going to experience with the medication. And there's certain medications that might have more favorable side effects for a person versus another. And it really kind of depends upon your personal preferences. Like, for example, if you're worried about memory loss because you have a very high functioning job, then where you use your brain all the time, then taking a medication that might cause memory loss might be a real issue. But there are, other situations where you might choose one medication versus the other. So if the doctor doesn't know how to titrate the medications and to choose ones with low side effect profiles and ones that fit what the patient wants, then you may never be able to find the right combination of medications that may help.
Right. That is a very good point. Are there particular groups of people with migraine that you find experience more side effects than others?
Well, I would probably answer that in a few different ways. One is if patients have, moderate to severe anxiety, they tend to be very concerned about medication side effects. And I think it's very possible too that they may actually experience more side effects than other patients. Second, there's a group of patients that have something called mast cell. It's like mast cells are important in the allergic response, and some medications can activate these inflammatory cells and cause them to release different proteins and other chemicals that might actually cause an allergic response, but in some cases may cause migraines as well. Those patients tend to be very sensitive to medication side effects. In fact, oftentimes someone with mast cell disease might have 8, 10, 12 either medication intolerances or frank allergies.
Mm-hmm.
And then the third, there's actually two other groups. One would be patients that run really, really low blood pressures.
Mm-hmm.
So if you run blood pressures like in the low 90s or maybe even in the mid 90s, it really knocks out all the blood pressure medications that you can take, or if you do use them, you have to use microscopic doses. Otherwise, patients are going to get fatigued or they're going to feel like they're going to pass out when they stand up because it's going to drop their blood pressure far too low.
Right.
Then the fourth group would be patients who are older, because as people age, the way the drugs are metabolized and the way they're distributed throughout the body is completely different. So you can be someone who's older and you may have tolerated a medication for years. And then as you get older, all of a sudden that same dose is no longer tolerable to that person. So those are probably the four groups of people that I think that might have more medication side effects than others.
Right. And I just wanted to clarify that when you spoke about blood pressure, you were talking about systolic blood pressure in 90s, the top number of blood pressure. People with blood pressures that low often have trouble. And also, many of us with migraine take blood pressure medications as part of our migraine treatment, which is why you were addressing that, I believe. So that's an important point, and we're going to circle back to that when we get to preventive medicines. So what do we do? Here's the most important question. How do you address these patients in your practice? Let's start with acute medications, meaning the medicines that we take once we already have a migraine or feel a migraine coming on and we want to stop it. What are the best medicines to take that have the lowest side effect risks and side effect profile? What do you do for patients in these situations?
Well, first of all, I kind of gauge, based on my interaction with the person, how sensitive I think they're going to be to meds. So I get kind of like almost like a sixth sense that they're going to have side effects. So if I think that's really the case, and I might even ask the patient, I said, do you have a lot of side effects in medications? If they do, and I'm using an abortive med or acute med, which is just used when you treat migraine, there are certain meds I would go towards.
Mm-hmm.
One is anti-inflammatories. So as long as you don't have a history of an ulcer of your stomach or something called gastritis, which is inflammation of the lining of the stomach, or you're real sensitive to GI upset, from anti-inflammatories, they tend to be generally pretty well tolerated. So
Mm-hmm.
I might use an anti-inflammatory. Within the triptan category, that's the group of meds that includes sumatriptan and imitrex or rizatriptan, which is called Maxalt. That group of meds, there are certain of the triptans that have lower side effect profiles. The one that I commonly use is one called naratriptan or Emerge, because that has a very low side effect profile. But another one called Frova, or the generic name is Frovatriptan, is
Mm-hmm.
another one that has a low side effect profile. And the third one is Almotriptan or Axerd. So those are the three I would go to if I was going to use triptans. Now, some of the newer meds that just came out, they're called Gepants. And in the Gepant category, there's one called Rimagepant, which is Nurtec, and the other one is Ubrogepant, which is Ubrelvy.
Yeah.
Those have very low side effect profiles. So those are really nice meds for people that can't tolerate other meds. In fact, I've used those in a lot of patients that have med intolerances and really have had very favorable results. The only side effects to those meds would be nausea in just a very small percentage, like 3 or 4%, and a little bit of sleepiness in some patients as well. But that's really the only other side effects. So those are probably the three groups of medications I would use, both anti-inflammatories, certain types of triptans, and then this Gepant category that just came out.
Okay, great. So let's move on to preventive medicines, meaning medicines you take every day to keep the migraines from coming. So which of those have the lowest side effect profiles? Which of those are best to use in people who maybe have issues with lots of side effects with medicines?
Well, each of the preventatives has a different side effect, profile. So, there's, like I said before, there are certain groups of people that might have more side effects to one versus the other, or they might be contraindicated. Like for example, with topiramate, which is one of the most commonly used medications, or Topamax is the trade name for it. Kidney stones can occur. So if you've got a
Mm-hmm.
history of kidney stones, then I might tend to avoid Topamax. If you have memory or cognitive problems, I probably wouldn't use topiramate either in that situation, because it's going to worsen those symptoms.
Right.
We talked about the low blood pressure issue with a lot of the blood pressure meds. So many of the migraine preventatives are blood pressure medications. That's their first indication. It was just found later on that they were effective for those with migraine, but those may not be a good choice in someone with very low blood pressure. But the ones that I think that have the lowest side effect profile, one would be the ARBs, which is the angiotensin converting blockers, the ARBs, and the one would be called Candesartan, and
Mm-hmm.
that one has a very low side effect profile as a blood pressure medication.
Right.
And then some of the newer monoclonal antibodies, these new shots that just came out,
Mm-hmm.
there's actually 4 of them now on the market. Basically things like Aimovig and Ajovy and Emgality and so forth. Will have a very, very low side effect profile as well.
Mm-hmm.
And then finally, other meds that are really well tolerated is Botox. I mean, Botox has its own unique side effects. Like
Mm-hmm.
droopy eyelid would probably be the most common one, that and neck pain. But generally speaking, it's a local therapy that's administered by, there's like 31 tiny little shots throughout the head and back of the neck. And that tends to be really well tolerated as well in patients that have a lot of side effects, because the therapy for the most part, stays local. I mean, there are rare instances where it can spread, but that's rather uncommon. So.
Right. Well, let's talk about really quick some of the tricks that are important with preventive medicines, like titration, titrating it up slowly. Can you talk about that really quick?
Well, we talked about before about getting, the doctor kind of having a kind of a sixth sense about who's going to be real sensitive to medication. So if I know when someone's going to be really sensitive, I'm going to increase the meds at a much slower rate. In fact, I might even use what I would consider a pediatric dose in those people, because what I found is if I go up slow, I can often get them up to a dose that might be therapeutic. But if I ramp the med up too quick, they develop side effects, and then all of a sudden I lose that med, not just for that moment, but oftentimes they don't want to take it after that. So you'll say, well, I'm sorry, but I increased your, say, topiramate or Topamax too quickly. You have side effects. Let's just back it down, a dose or two. And they'll say, oh, no, I don't want to take that med anymore. I don't like the side effects. Right. So it's really important that you increase slowly. So I would say that with most meds, I start off low and go slow. And if someone is really sensitive to meds, then I might even start even lower and go even slower in that group of people to minimize side effects.
And I think something that people don't mention is that sometimes you get really lucky when you titrate and you go slow and you find out that that person sees benefits at a really low dose. And that's a great thing. So it's something to look out for. I have told my physician before, hey, I don't think I need to take what you're saying I need to take. It's already helping me. So I think that's something to look out for as a patient and as a doctor. Really quick, I think we have time. Do you think that there's use for devices in people who maybe have a lot of side effects when they take medicines?
I do. I think that the devices, for the most part, are very low side effect. There's one abortive device called Nerivio that just came out about 8 or 9 months ago. That is basically an armband that you put on the upper arm, and then you can hook it up to your cell phone and kind of crank up the current. And it does provide a mild discomfort to the upper arm, but for the most part, doesn't have a lot of the other side effects that patients experience. There's another device called GammaCore, which is a vagal nerve stimulator that you put on the neck. And the biggest side effect there is it can kind of pull the corner of your mouth down while you're getting that. That's probably, and cause a little bit of mild discomfort in that area as well. But and there's also something called a TMS stimulator, TMS Mini. It's basically a magnetic field that gets delivered to the back of your head. You put this device over the back of your head and you put it here, and then you actually click it a couple times and to basically get it to discharge. And that has a very low side effect profile as well. So I think the devices are options for people that have a lot of side effects.
Okay. All right. Well, is there anything else you'd like to add to our conversation on medications, side effects, and treating people who get a lot of side effects with their medicines?
I think you just need to play to your audience. Like if someone says, I'm not worried so much about side effects, I want efficacy. So like in that situation, I might go with a drug like topiramate or Topamax, which is really, in my mind, if I had one therapy I give by mouth to treat the person with as a preventative, if you told me you're only going to give me one chance, that would be the one, as long as the person doesn't have a lot of side effects. Because with that one, you can get pins and needles at your fingertips, you can get memory loss, you can get kidney stones and other side effects as well. So like rare cases of glaucoma and so forth. So I basically listen to what my patients say, and then I decide based on that which drug I may choose based on what they consider as a favorable side effect profile and favorable efficacy. And I use that to basically mold or guide my therapy for the patient.
Right. Okay, well, thank you so much. And thank you everyone for joining us for this episode of Heads Up. Please join us again next week. Thank you and good night.